In Mitchell's Plain, a beacon of hope emerges in South Africa's ongoing fight against gender-based violence. South Africa's 65th Thuthuzela Care Centre was launched on Monday, the 19th of August. The centres are a critical part of South Africa's strategy to combat GBV and have been providing essential support to victims for over 2 decades. Established in 2001, Thuthuzela Centres are one-stop facilities that offer medical, legal and psychological support to survivors of gender-based violence, ensuring they receive holistic care in one location.
So the scourge of the gender-based violence in South Africa is extremely huge. And the people that report sexual violence, it's actually the tip of the iceberg. So when you come to this TCC, you will see the person would arrive there and would be seen by a range of different stakeholders that work within the TCC. So the impact of that is, it is really the immediate, the access that the client has to justice. So there will be an NPA official that will see the client. From the organization side, there's a first responder, that's a social auxiliary worker, and that person will do the trauma containment. The next step in the TCC model is a client will see someone from the Department of Health, where HIV testing is done, there's screening for TB and STI. There's also, if the rape is reported within the first 120 hours, we can provide emergency contraception. But important also is someone that arrives is tested for HIV, and if the person tests negative, that person can then be initiated on PEP. If someone initiates positive or tests positive, that person can be initiated on ART. And the importance of that ART, it's a lifelong treatment that the client must be on. So it's a double whammy. We also always call it a double whammy, where someone has just been raped and here they discover they're also HIV positive. So as part of this process at the TCC, the process of initiating the person can then be started. There's a clinical forensic examination that's done. So it's either a medical doctor, or in the case of the Mitchell's Plain TCC, we've got a forensic nurse that is doing the investigation, the forensic examination of that client. After that is done, only after that is done, the client will get the opportunity to take a shower, and then the clothing that she has is then taken, and that is kept as evidence if someone prefers to open a case with the police.
The centres have been successful in improving conviction rates. Despite their success, there aren't enough centres due to a lack of funding. 5 years ago, close to 50% of centres were under-resourced and could not provide counselling and other services.
The Thuthuzela Care Centres are a unique one-stop integrated response to incidents of violent sexual acts against women and children, and they aim to reduce secondary victimization, improve conviction rates, and reduce the cycle time for finalization of cases. This is one of our more effective interventions, and we must develop concrete proposals on how we can strengthen the operations of these centers. Now, this is what we want to hear. Where these centers are not working optimally, we would like to hear. And if it's a shortage of money, we will make money available so that they work. We agree, the demand has been made, and we agree with the demand that we must continuously ensure that lay counsellors at these centers undergo training on an ongoing basis to deal with the needs of victims of violence.
At Presidential Summit held in 2018 and in 2022, President Ramaphosa declared that there should be more TCCs. He's also highlighted this in the past few years during the SONA addresses. Do we have enough Thuthuzela Care Centres? The answer is no, we don't. Is government doing enough? The answer is also no, government is not doing enough.
Just in terms of services, counselling services, the Department of Social Development is responsible for the Victim Empowerment Program. So across the country, they make sure that the services provided at the Thuthuzela Care Centres. But funds are limited. So very often there will be one social worker that will provide the service. But through international donor funding, and in the case of NACOSA, we've got the Global Fund that is providing psychosocial support through NGOs that render the service, as well as the USAID, the PEPFAR grant that's also providing psychosocial support to clients. So funding is one of the biggest problems, obviously for government. But donor funding is making it easier and making it possible to provide psychosocial support. But it's still a challenge. If donors, if the grant comes to an end, what happens then to that service?
To learn more about the Thuthuzela Care Centres, visit the link below.